They say the eyes are the window to the soul, but new research suggests that eyes, specifically the retina, may offer a window into how well we are aging and give unique insights and understanding about overall health. Here to discuss this topic, as well as the use of human AI partnerships in ophthalmology care and medical research, is Dr. Manjot Gill, a Northwestern Medicine retina specialist. She is the vice chair of clinical performance and professor in the Department of Ophthalmology and professor of medical education at Northwestern University Feinberg School of Medicine. She is also a member of the Human Longevity Laboratory within the Podeshnak Longevity Institute at Feinberg, where a group of scientists are conducting a longitudinal cross-sectional study that investigates the relationship between chronological age and biological age across different organ systems and aims to validate interventions that may reverse or slow down the process of aging. Welcome to the show, Dr. Gill.
Thank you so much, Erin. Happy to be here.
Well, in a previous episode of this podcast, we talked about the launch of the Human Longevity Laboratory. But can you refresh our memories a little bit and describe the vision behind the laboratory and this study and what makes Northwestern Medicine's approach to understanding and extending healthy aging so unique?
We are really very excited about the Human Longevity Lab. This was really conceived by Dr. Douglas Vaughn, and he has really spent his career researching aging and particularly superagers. So, what we're doing is approaching the study of aging in a very multidisciplinary, very methodical, scientific fashion to really look at aging in various different organs, across various organ systems in a longitudinal fashion, and to really try and understand the relationships between chronologic age and biologic age within and across individuals, but also across people of different socioeconomic, different geographic backgrounds, and really look at this in a very scientific fashion in the hopes of trying to understand aging much better. And then also in the hopes of trying to come up with interventions that may be able to slow down the aging process.
Again, this is a unique study. There's so much longevity research that seems to be taking place. There's a lot of sort of pop culture longevity things happening in the media. Can you talk about the rigor that's involved with this study and how it's different maybe than some of the other things that we hear out there in the media?
Yeah, I'm really glad you brought that up, Erin, because that really is, I think, what sets apart our lab and what we are doing, because we are really looking at this in a truly scientific fashion in terms of patient recruitment and extracting all of the data in a, multidisciplinary approach. We are looking at various biometrics as well as cognitive function, cardiovascular function, pulmonary function. We're doing retinal imaging, obviously, and genomic testing. So really trying to gather data in a very standardized fashion across all of our subjects that are recruited, and then eventually longitudinally follow these patients to look for the trajectory of their aging. So this is, I think, what really is unique in that we're not really focusing on one organ system. We're looking at multiple organ systems and looking at the relationship of aging across various organ systems and study how that may be different. Because that is one thing that we really actually don't understand is aging the same across different organs? Does your brain age at a different age than your heart? And is that similar within individuals, or are there different time points in one's lifetime where one organ system may age quicker than others?
Your work revolves around using the retina to study biological aging. In previous research, you've actually found the retina to be a pretty good marker of certain diseases. Can you tell me about that?
This really is part of a larger field, an emerging field known as oculomics, where we are utilizing the retina as a biomarker for systemic disease. This is what really got me very excited, and this is largely the focus of my research. The retina is an extension of the brain. It has similar embryologic backgrounds as brain tissue. And so we may be able to gather insights about brain health by imaging the retina and looking at the various layers of the retina, as well as the vasculature of the retina, and seeing if that is a reflection of what may be happening in blood vessels within the brain. In a similar note, the circulation of the retina also communicates with the circulation in the rest of the body. So, various cardiovascular diseases may also manifest themselves within the retinal vasculature. So, that's another way in which we can study both disease and the aging process. We actually have found signals in a variety of disease states, long COVID being one of them. We looked at a population of long COVID patients and compared them to age matched controls and did, in fact, find that patients with long COVID did have decreased blood flow in their retinas. So, this is the first finding that we've actually found that there are biologic signals, physiologic signals in patients with long COVID. So, this may help not only in the detection of patients with long COVID, being able to follow them now with a physiologic marker, but also may provide insights into what the cause is for long COVID and come up with interventions. In a similar vein, we looked at a population of patients who were at risk for heart failure, who did not have established heart failure, but did carry a risk for heart failure because of a variety of systemic risk factors. And we did also find that compared to age-matched control eyes, that those patients at risk did in fact have decreased blood flow in one layer of the retina. So that speaks to the power that the retina may have. And by looking at the vasculature in the retina, we may be able to detect those patients that are at risk prior to the onset of heart failure. So, what we're doing specifically in the Human Longevity Lab with respect to the retina and aging is capturing fundus images, retinal images with a camera and getting really high quality retinal images and then running it through an AI model where we're comparing it to millions of other retinal images and being able to render a biologic age to the retina. And this is based on the color of the retina, various features such as pigmentary changes, other age related changes, and largely based on blood vessels. So then we will ascertain a biologic age, and then we can compare that to a patient's chronologic age.
What can you tell me about some of the preliminary data that you've found so far? Is there a large gap sometimes between biological and chronological age of the retina?
So we certainly can see this. In majority of the patients that we have studied so far actually have their biologic age is lower than their chronologic age. And that largely may be just driven by the patient selection, gathering mostly younger, healthier subjects. Where I think we will start to see some gaps is as one's chronologic age advances. And then certainly if they're afflicted with more systemic diseases such as diabetes and hypertension. And I also think what we will also find is that we're going to have a trajectory where one may see that there is kind of a gap between chronologic age and biologic age, but then that gap starts to narrow as one ages. So there may be, what we find through our study is that there are critical periods where there is a gap and potential for interventions where we can actually slow that trajectory of aging.
Are there current treatments that could possibly do that? Or is this something that would be in the future that you would have to look into?
As you had mentioned earlier, this is such a hot area right now. So there's a lot of things that are purported to slow down the aging process. I think one of the things that's been talked about has been metformin. I still think that is, relatively inconclusive. I think there's a lot of excitement surrounding the GLP-1 agonists with respect to, not only their impact on diabetes, but on metabolic syndrome as a whole. You can imagine if they're helpful in helping one's weight and obesity, hypertension, diabetes, that would also have a positive effect potentially on slowing down the aging process. So I certainly think there could be some area of interest there. Other things such as healthy diet, lifestyle, stress reduction, mindfulness. In fact, we're running a small clinical trial right now through the Longevity Lab looking at mindfulness intervention over the course of 2 months. And so it'll be interesting to see these various measures that we take before and after if there is in fact any change. And I think this is what we're all going to be learning is not only about various interventions, what may show some promise, but also are these curves even malleable? Can we even alter or change one's trajectory of aging? Because everything that is out there right now is largely anecdotal, but nothing is really studied in a truly scientific fashion. And that's exactly what we are doing. And this is what sets apart our lab from anywhere else in the world.
Well, and what's also nice is that participants in this study are able to gain some information about their own health and possibly make some changes, which is different than some other studies.
Absolutely right. We're not purporting to be offering preventative care per se, but certainly in the course of evaluation, if an abnormality of some type is detected, for example, I read all the color retinal images, and if we find something, a patient may be a glaucoma suspect, then we certainly do reach out and make sure that the patients will get the appropriate care.
You mentioned that you use an AI model when looking at these images. How new is using AI technology with the retina? And how do you partner with these outside companies to make this happen?
Yeah, so this was interesting. When we first launched the longevity lab a few years ago, that was an area of interest of mine is how are we going to leverage the power of the retina and bring this into this whole model of aging? And so kind of looking through the literature, I came across an industry partner, Toku Eyes, and they have developed this model where in which they, by looking at color images of the retina, are able to ascertain a biologic age. And so we have since partnered with Toku. And like I said, this field is just continuing to grow and expand, not only in the area of longevity, but just in terms of systemic health as a whole.
You're an expert in this area and you've been using your own human eyes to look at these images for years, but now to really have this sort of advanced supercomputing power under your belt, what does that mean to you?
You're absolutely right. Obviously, I chose the field of ophthalmology and retina in specific because I feel that vision and sight is so precious. But now that we can actually use this tissue, the retina, to get insight not only into systemic disease, which we have been in terms of diabetes and hypertension, but now to really gather insights into what may drive disease, what may drive aging, and then really the key is in terms of prevention. How do we prevent and intervene at a much earlier stage? So the retina may offer unique insights that other organs in the body are not able to because of the fact that it is so readily accessible and readily visualized.
You recently co authored a Nature Communications paper about a large language AI model that enhances how clinicians and researchers mine medical literature to help you more efficiently conduct reviews of literature mining. Tell me about this study and how that kind of plays into everything that you're doing here.
This was a multidisciplinary paper, and essentially it is looking at using large language models to conduct literature searches. And so I served as a control and selected papers that I felt were the most relevant and topical in a particular area of interest. And what we found is that the large language models were equally effective in terms of selecting those papers that the model felt were the most relevant in terms of the literature search. So this really is very exciting because it takes a lot of kind of the manual task out when we're conducting literature reviews.
In this particular model, this is not Chat GPT. This is a model that is specifically designed for medical researchers.
Correct. Yes, it was actually designed by a researcher at Northwestern.
Where could you possibly see AI being used in other areas of ophthalmology?
In terms of patient care, being able to help the physician in terms of, diagnostic, therapeutic interventions, being able to help with image interpretation. I know there's been some work that's been done in radiology to semi-automate the interpretation of radiographic images. Ophthalmology, as we know, is very image heavy, and so there may be a utility there as well in detecting patterns in images as well. We can use this as a recruitment tool for clinical trials to identify patients who may be amenable to certain therapies by screening their images. I actually just did a study that looked at large language models, ChatGPT and Gemini, and we fed them publicly available color photographs. So this is not patient identified data. This was publicly available data set and had it screened for referable diabetic retinopathy and found that the large language models were equally, if not more effective than some of the FDA approved AI screening devices that are out there.
Wow.
And so this just goes to show how powerful this is. Eventually we could say that, we could use that as a proof of concept that we can try and create these own large language models that help us interpret images within our own health systems.
You mentioned clinical trials. This is another area that you are very active in, and you have been working on some other age related related eye conditions and had some pretty exciting results from clinical trials so far. Can you just talk to me about that and your commitment to finding better solutions and treatments for patients?
So this is really how we push our field forward is through clinical trials with scientific rigor and doing it in a very methodical way. So, I was very pleased that I was the principal investigator on one of the second generation therapies for macular degeneration, which has now since been FDA approved and is widespread usage across the country, across the world for wet macular degeneration. But we have such a high treatment burden with our therapies in that they are effective, but as long as the patient keeps getting the drug. And so this can be very, cumbersome for patients as well as for the practices to have some of these patients coming in every month. So we're always looking for newer drugs that may have different mechanisms of action as well as different platforms of delivery that would allow for these drugs to be utilized less frequently. So the most recent clinical trial that we concluded looked at a different delivery platform rather than injection of medication into the eye, but implantation of a sustained release device where the drug can be released into the eye over a prolonged period of time and therefore not needing repeat treatment for between 6 to 9 months.
If you could offer some advice to listeners about healthy aging, especially when it comes to the eyes, what are some things that everybody could start implementing if they're interested in aging healthy?
I think that's the thing that I probably get asked the most as as an ophthalmologist, as a retina specialist. So I would say there's several things. UV protection is so vitally important. We know that UV associated damage can accelerate cataract formation, also as a risk factor for macular degeneration. So wearing sunglasses, wearing a hat, particularly if you are light skinned and blue eyed, is extremely important. Secondly, a good diet. I always tell patients that whatever is good for your heart is good for your eyes. And there's been so much evidence about the Mediterranean diet. There is also evidence that has been looked at with macular degeneration and the benefit of the Mediterranean diet on slowing the progression of macular degeneration. In addition, some patients, depending on whether they have macular degeneration and a more advanced form, would benefit from vitamin supplementation, particularly an AREDS2 formulation has been shown in clinical trials to slow the progression of macular degeneration. But this is not for all patients. So this really would be under the direction of and advice of your ophthalmologist if you had a certain stage or degree of macular degeneration. Otherwise, if you want to take a good multivitamin, that would certainly suffice. And then other lifestyle factors, particularly smoking, similar to UV damage, smoking we know can accelerate macular degeneration because of the free radical formation and all of the negative effects that it can have in the eye. So if patients are smokers, really counsel them to encourage them to cut back or to quit smoking in general.
A decade from now, what breakthroughs do you hope we will be talking about when it comes to using the retina as a biomarker of aging and overall health?
I feel we are on sort of the precipice of some real change in terms of how we think about disease, and especially how we approach and manage patient care. So, what I envision, and I hope it's not too distant into the
Yeah.
future, is being able to walk into either your primary care's office or, into a Walgreens, getting a retinal scan done. And then by entering a variety of kind of basic data about your diet, your lifestyle, how frequently you exercise, what medications you're on, that you would get kind of a risk stratification of your future risk for either diabetes, high blood pressure, heart disease, stroke. And then not so much being able to detect these early, but to really give you tangible information on how you can intervene to really slow or minimize the onset of these chronic conditions. And then hand in hand with that is by being able to do that by preventing the onset of disease, not just detecting disease, but preventing the onset of disease. This is really how we are going to be able to increase one's health span and not just lifespan, but really health span. So I think that really is the secret to longevity.
Thank you so much, Dr. Gill, for being on the podcast and sharing all these exciting new developments with the retina. I appreciate your time today.
Thank you so much, Erin. It was a pleasure.
Thanks for listening. Please click the bell to receive notifications about our latest episodes and follow us on social media at NU Feinberg Med to stay up to date with our latest research findings.